Okay, think back for a second to your very last headache. Maybe it was just this mild, really annoying pressure after staring at your screen all day, or maybe it was this pounding, agonizing pain that literally made you go lock yourself in a dark room. Most of us, we just pop a pill, chug a glass of water, and try to power through it. But do you actually know what your brain was trying to communicate? Like, is it ever just a headache, or is it a symptom of some complex biological process playing out inside your nervous system?
Well, welcome to this explainer on the absolutely fascinating medical literature behind headaches. I am incredibly excited to share this with you today because the biggest secret in neurology is that a headache is not just one single condition. There are dozens of completely distinct headache disorders, and they all feel and behave entirely differently from one another. So today, we're going to completely demystify these conditions, meaning you will never have to guess what's actually happening inside your head ever again. So let's dive right into this.
To keep everything super clear and engaging, we're going to take a journey together through 4 distinct categories. First, the common culprits. Second, rare and severe. Third, situational and triggered. And finally, urgent warning signs. All right, starting right off with Section 1, the common culprits. Let's pit the 2 most common headache types right against each other, since this is where the vast majority of us live when it comes to head pain. On the one hand, we have the tension-type headache. This is that pressing, tight band wrapping right around both sides of your forehead. It's usually mild to moderate, just annoying. But a migraine? That is a whole different beast. A migraine is a full-blown neurological disorder. It's characterized by this intense, pulsating, throbbing pain, usually locked on to just one side of the head, and it brings along some really awful friends like severe nausea and extreme sensitivity to light and sound. Now, a really key feature of migraines is something called the aura. And, people hear the word aura and they instantly think of something kind of mystical. But medically speaking, it is a very real temporary neurological symptom. We're talking about seeing flashing lights, weird geometric zigzag patterns, or even expanding blind spots in your vision. Sometimes it literally includes tingling in your hands or difficulty speaking. It develops gradually over several minutes, but here is the absolutely crucial point. Not every migraine comes with an aura. Actually, a ton of people suffer debilitating migraines without ever seeing a single flashing light. Moving on to Section 2, rare and severe headaches. Now let's look at the really brutal reality of cluster headaches. Unlike migraines, this pain is strictly on one side, usually centered right around or directly behind the eye, and it's fast. These attacks reach a severe, agonizing 10 out of 10 intensity incredibly rapidly. What's absolutely fascinating and frankly terrible for the patient is the pattern here. They happen repeatedly in these grouped cluster periods. Your eye might water uncontrollably, your nostril on that side might block up, and unlike a migraine sufferer who just wants to lie perfectly still in a dark, quiet room, someone with a cluster headache feels extreme restlessness. They might literally be pacing the floor in total agony. Next up, we're grouping 2 very rare conditions together, hemicrania continua, which is this continuous one-sided pain, and paroxysmal hemicrania, which involves shorter but really frequent attacks. Now, what's amazing here is a total medical quirk they both share. Both of these specific, severe disorders respond miraculously to one specific medication called indomethacin. Seriously, if a doctor prescribes this and your headache just completely vanishes, they know exactly what rare disorder you have. It's literally like a biological lock and key. Okay, let's rapid fire through the short and sharp category. Sunkt and Suna are these incredibly intense, one-sided attacks that last only seconds to maybe a few minutes, often turning the eye bright red and watery. Then there's the much more common ice pick headache, and it feels exactly like its name implies, a sudden, super brief, stabbing needle sensation that just pierces your head out of nowhere. It's completely random, usually harmless, and often disappears just as fast as it strikes. Which brings us to Section 3, situational and triggered pain. All right, we have got to debunk a massive, widespread misconception right here. How many times have you felt facial pressure, a blocked nose, and immediately thought, ugh, I've got a sinus headache? Well, the medical literature reveals something wild. Many of these so-called sinus headaches are actually just migraines in disguise. Because migraines activate your trigeminal nerve pathways, they can totally cause nasal congestion and facial pressure too. A true sinus headache actually involves thick, discolored mucus and an acute underlying infection. Knowing this difference is a real game changer because it completely changes how you should be treating it.
When we look at primary cough, exercise, and sexual activity headaches, we see that something as basic as laughing really hard, heavy weightlifting, or even having sex can directly trigger localized head pain. But look closely at the shared warning across all three of these. If you ever experience a brand new, sudden, and severe headache during these activities, it should never ever simply be brushed off. It absolutely requires a medical check to make sure there are no underlying blood vessel issues going on.
Now here is a frustrating trap that so many well-meaning people fall into, the medication overuse cycle. Step 1, your headache begins. Step 2, you take some medication for temporary relief. Makes sense, right? But step 3, the headache returns, leading you straight to step 4, taking even more medication. Over time, your body adapts, and step 5 hits. You actually develop chronic, near-daily headaches caused by the very medicine you thought was curing you. It's a vicious cycle, and you usually need professional medical help to break it.
Finally, we arrive at Section 4, Urgent Warning Signs. First up is a term you absolutely must commit to memory, the Thunderclap Headache. Notice how stark this definition really is. The extreme danger here lies not just in the sheer severity of the pain, but in its sudden 0 to 60 explosive onset. It hits its absolute maximum intensity within seconds to maybe a minute. This is an immediate medical emergency because it can signal life-threatening conditions like a subarachnoid hemorrhage or a torn blood vessel in the brain. In fact, patients who survive a thunderclap headache frequently describe it using one exact, chilling phrase: the worst headache of my life. If you, a friend, or a family member ever say this out loud, treat it as an absolute emergency until serious underlying causes are completely ruled out by an ER doctor. There's no playing around with this one.
So it's all about recognizing these exact emergency red flags. We talked about that explosive onset for sure, but also look out for a headache paired with other neurological symptoms. If someone has a headache alongside weakness, numbness, confusion, or difficulty speaking, call for help immediately. A stiff neck paired with a high fever? Huge red flag. Or if someone develops a completely new, significantly different headache pattern later in life, or say during pregnancy, they need an immediate medical evaluation.
And this brings us right to the core lesson anchoring this entire explainer, the rule of change. Look, most headaches are not life-threatening brain tumors. A familiar headache, even if it hurts a lot, is usually just a condition you can manage. But a completely new, more frequent, or totally differently behaving headache, that change is the true warning sign your brain is giving you.
We have traveled all the way from everyday tension bands to the rarest severe conditions, and finally through the absolute medical emergencies. You now have the actual knowledge to decode the signals going on inside your own head. So I want to leave you with this final provocative thought. The next time you feel that familiar ache, will you know exactly what your brain is trying to tell you? Use this knowledge, empower yourself, and never just dismiss your body's vital signals as just a headache ever again.